My name is Rabih Chaoui. I'm a specialist in fetal-maternal medicine and the co-head of the Center of Prenatal Diagnosis in Berlin, Germany. I'm grateful to share with you my experience with ViewPoint over the years, and I start by congratulating ViewPoint for their 20th anniversary joining GE Healthcare. When people ask me how long I've been using the ViewPoint, no one believes me because we started at the university around 93, 94 with one of the first version of ViewPoint. At that time, the Charity Hospital, we had the first time a kind of intranet in between the different clinics with the new establishment of computers at that time. And we wanted that the fetal medicine unit is linked to the neonatology on one hand, but also to the pathology. So the file of the patient was in the three places, and the pathology had also a ViewPoint system installed, and the reporting was for all three of us. Then we implemented in the first computers what is called a frame grabber, which facilitated the possibility of capturing images from the ultrasound machine, but also from a digital camera, which is quite new at that time. It was quite expensive, so that we could, from our lab, see the images done at autopsy of the fetuses after termination of pregnancy. I have seen over the years the technology of ViewPoint evolving, because in the late 90s, the collaboration with Kipros Segalidis led to the implementation of the fetal database in the version 5, and then it was, in addition to documenting examination and storing images, the possibility of having charts and the long checklist of many different anomalies with comprehensive examination possibilities and reporting. So from admission of the patient until reporting. So data from the insurance card are important in the ViewPoint software. ViewPoint is connected via DICOM to our GE Voluzone ultrasound machine, and the data are imported so that we can examine the patient directly with the correct name and birth date and so on. The measurements of the patient and the images are then directly transferred to the folder of the patient to generate the report, so that there is no room of any mismatching with other patient name as in other system when you enter the data manually. ViewPoint, in my opinion, to summarize, is the perfect system and companion of each fetal medicine specialist. It has three pillars which are crucial. It is, on one hand, a perfect reporting system, including also reference ranges from all measurements performed, and is also customizable, as you know, from the version of ViewPoint 6. ViewPoint is mainly a documentation archiving system where one can store not only still images, but also videos and 3D volumes if needed. And third, ViewPoint is a database, including all measurements performed, but also images related to diagnosis, and also keywords if you add them. This enables one to go back to the database and perform research. Almost all my paper research I did would have not been possible without the ViewPoint database, from the ARSA, the IT, maxillary gap, and so on and so forth. This is why, again, I want to thank all of you for the versions over the last 20 to 30 years, and the engineers who are still working on new development, and I congratulate you for the anniversary and for this long journey and commitment to patients' care. I'm looking forward for your next innovation. Thank you.